understanding the people that did get infected. From a business continuity point of view, it was something or nothing in the end.
Yeah, especially with SARS.
And SARS, this is something brand new territory, and we've got, this is a little bit different. We're not a care service, but we have got people delivering compliance in people's homes. So we're trying to put together, establish today a safe system of work, supported by infection control training, so that our trades, if you like, can go into homes that have been affected in one way or another, either positively or family self-isolating, to do just critical or essential works. We're not calling them emergency works because we're not an emergency service.
David, if you can leave us your email address. We've done some work with other social housing groups.
Okay.
So if you could be kind enough for me to leave your email address, we'll share what we've given to others, if that can, sort of benefit and help you guys at the moment.
Yeah, absolutely, and appreciate that. You can never have too much information at this stage, Yeah. So I'll let you guys crack on, and I'll join in a bit. I'm just going to
make a cuppa.
Make a cuppa. So mute myself for a second, if that's okay. And I'll join you shortly.
Okay, no, that's great. Thank you.
Thank you very much.
Peter, I still can't message you on Skype.
And I'm having the same problem. So actually, I'm on Skype as such, but it won't allow me to actually open my normal account, as it were, which is really daft. Can you either email me or as you did yesterday, or just text me?
Let's email, because I need to copy and paste stuff. So
yeah,
I'll email.
Okay, all right, that's brilliant. Thank you.
Morning, Matt. Morning, Helen. Thanks for joining us.
So Claudia, just as a sort of bit of a feedback, what I suggest is that I think the topic around facilities team is a good one to actually pick up, and I think between you and I we could ask that question actually.
Yeah, it's tough, isn't it? Because I was asked, do you know how to test a fire alarm? I don't know. I don't work in a building.
Yeah. Okay. And just as a question for everybody on the call, is everybody okay, and are all your families all right as well?
I'm guessing everyone's on mute.
So far, so good.
Struggling to get toilet paper.
And Andy, I thought you had cling film for that.
Oh yeah, and there's also the Sun, which is not a bad option, is it? The Sun newspaper.
Well, that's true. Yeah.
Oh, this is too early for this conversation.
Yeah. But on a serious note, my dog had an operation. It had a twisted gut. So it had an emergency operation. We're supposed to give it paracetamol. Can we find any?
Oh, you can in Cardiff.
Yeah.
All good drugs there.
I'm sure you can get anything in Cardiff, right?
Okay. Make it in the kitchen. Yeah, there's been a new paper come out about the temperature.
Yeah.
Yeah, they've now dropped it to 21 to 23 degrees C, which is room temperature.
Okay.
I'm actually looking at the original paper in the New England Journal of Medicine.
Okay.
We'll just give it another minute or so, and then we'll get started.
Okay.
Do you want me to post the link to that SHP article?
Yeah, that'd be great, please.
Okay, Peter, should we kick off?
I'm good to go.
Yeah, great. Okay. Morning, everybody. Thank you for taking time out of what must be a crazy, busy schedule for you all right now. The reason we're hosting these webinars over the past couple of days is because here at Cardinus we've all been receiving a lot of calls from customers and non-customers for advice and guidance on how to deal with the challenges of COVID-19, and especially the challenges of us moving to a home working situation without really any warning, without any time to really prep for it. And so we decided we'd bring a number of experts together so that we could share the information that we have with you, but also to field any questions that you might have in particular. We know that some of you are especially challenged. Some of you may only have a few hundred employees working from home, but we've got clients that have hundreds of thousands globally who have been sent into that home working situation. And so to tackle this off, we've brought together a number of experts, and if we go to the Police Academy mugshot screen, I'll do a quick introduction for everybody. Peter Kinselley will be chairing the session today. Peter heads up our safety consultancy business here in Cardinus and has got a lot of experience in managing safety programs in that global space. We're also supported by Andy Neal. Andy heads up probably our newest division here at Cardinus, which specialises in loan working, security, especially international security. And Andy's got a huge amount of wealth that he can bring to the table in terms of that loan working element. Claudia Calder works alongside Peter. Again, lots of experience in working with large multinationals, great background, especially in the pharmaceutical space. And then we have two of probably the brightest minds in terms of stress and mental health with us today. Harry Bliss is founder of Champion Health and has an absolute passion when it comes to mental health and the ability of education and assessment to change lives and minds. We also have Jocelyn Shaw, who's Executive Director of Mates in Mind, which is a charitable programme launched in the Health and Construction Leadership Group in 2017, which is again having really positive impacts in terms of mental health within the construction industry. And then myself, my specialty here is ergonomics. And again, I work in that global space. So between all of us, we have some information that we want to share with you. But really crucially, we want to address any particular questions that you might have. And so, Peter, as chairman, I'm going to hand this over to you now. I've got a question that I had emailed to me last night, which I want to post to you initially. And that is, right now, we're sending lots of people to work from home. We don't know how long this period is going to be, whether it's just a few weeks, whether this is going to extend into a few months. So at what point do we take on a formal legal responsibility where we need to start looking at contracts and the specific recruitment elements relating to these people being home workers?
John, hi, good morning to you, and welcome to everybody who joined us. John, that's quite a complex question to be able to answer, because in reality, we are the government advice that's being provided to us is moving much faster than the legislators. And I think what we have to consider as part of this, our response, is that we have a duty of care to those that are working from home, and particularly those that are vulnerable. We also are asking people to work from home potentially in an environment where they are where they probably haven't got the right workspace or equipment. But what we'll aim to do during the course of this session is to actually address that. But also we've got to look at the challenges. You know, we've just had the announcement that the schools are going to close. We've got the additional burden of, you know, people working at home, probably at different businesses with the kids that are off school. And I think in reality what we've got to actually do then is move to some expert advice. And we've got posted on the conversation board a link to SHP Online, where Paul Verrico, who's an eminent lawyer, actually made the following comments. And I would ask you guys just to consider that as part of this. So his comment was, the message is simple: act responsibly and ethically, not out of fear of prosecution, but out of a sense of appropriate accountability to staff and stakeholders. And in reality, the most important thing here is to make sure that, you know, you are considering that. You know, we are in a very changing circumstance. And the key point he actually finishes off with is stay current and do all that's reasonably practicable based on government advice in this ever-changing situation. So in reality, you know, what we're going to do is encourage you guys to actually have a look at this from that point of view. Now, before I actually move on, I'm just going to ask you guys, you know, please, if you have any questions, you want to actually ask any of our speakers, you know, pose a particular question, please either post them or come off mute and talk to us. We're happy to be interrupted. And what I will do is just start or just move forward from there. So, Andy, Neil, just as a point of view, from a personal safety point of view, people are moving towards remote working, you know, so can you just give us a few insights on how we can actually make sure that people are that are home working are looking after their personal safety?
Andy, just before you pick that up, if I can just interrupt. Guys, when you're looking at your screen in the lower left corner, you will see a little speech bubble icon. When you mouse over it, it will say I am for instant message. As Peter says, if you want to ask questions verbally, by all means do that. Or alternatively, if you want to use the instant message, you will see a window pop up in the lower left corner, and there's other comments and documents that the group is posting in there that might support some of the answers. So please go right ahead and use that feature. Sorry, Peter. Sorry, Andy.
Yeah, thank you, Peter. I'll pick up from your question. Just in reference to lone working and some of the sort of conflict interests, we're already starting to see a shortage in stores of things like toilet paper and bread and paracetamol and different things. So one of the things that we're looking at, we think is key, is a network of communication that people from home can call into the offices, speak to their immediate line managers, and actually discuss any troubles they have. Clearly, with the children being off of school now, there's also planning at home between work and social conditions, which I'm sure that Harry and Jocelyn will pick up, but work and social conditions, so that they have a mix of the two, being parents and also actually working from home as well. So the difficulties is good communication plans from within an office towards the remote workers, and also planning from the workers' point of view in reference to planning for things like breads and toilet paper. We can only imagine if the situation gets worse, there will be a lot of social conditions that are involved with the communities not being able to get regular supplies that we would get normally. That's my only thought on that.
Andy, thank you. Jocelyn, can I just move on to you? Just following on from Andy and a question that we've had raised about lone and remote working. What, as leaders, what should we do to support our people?
Morning, everyone. Well, I think it's quite a challenge because apart from all the planning and adapting and learning, it's about sort of also getting the basics right. So very, very importantly, this is a period of change. In that respect, people need to have clear and regular information from all the appropriate parts of the organisation to just help give them at least confidence around the period that they're living through, and to understand clear expectations, know where they can go for information, or if they need to ask a question in respect of their line manager or from HR or from alternative sources as required, because this is moving quickly. A lot of people with family, with other responsibilities, will no doubt, those are additional pressures which the business cannot control for, but may have an impact on their employees and their staff. And it's so really keeping as much of the communication channels open in an effective and efficient way as possible, and just sharing the learning that the business is taking and moving forward.
Jocelyn, thank you. Harry, these are stressful times for everybody, and one of the challenges that we've got, very much is around maintaining ourselves. Have you got good advice for us all on what we should be doing at this time?
Absolutely. Good morning all, or good evening wherever you're joining from. I think it's so important, as important as ever, that we optimise employee wellbeing. Now, it's a huge passion of mine, but if we don't look after our people, from a moral case, it's not quite right, but also from a business case. So what we need to be looking at as senior members of staff is increasing awareness around sleep, nutrition, hydration, physical activity, etc. The stuff that really boosts our immune system and minimising stress. So in terms of sleep alone, it's really the foundation of our health and well-being, and it could take a massive hit during this period. As we're less active, we might not be eating as well, we might be more stressed and anxious, which takes a massive impact upon our sleeping behaviours. So in terms of sleep alone, a key action would be to encourage employees to maintain a routine where possible. Now, I know it's difficult, I know we're in unprecedented times, but if we can maintain a routine, so if we were to get up at 6 a.m. Normally to commute into work, encourage employees to still get up at those times and do something productive, whether it's in their home life or work life within that time.
Harry, just on that as well, if we sort of bear in mind that schools are closed, we're going to have kids there, and sort of various various other pressures, how is there any good advice on separating those activities?
It's going to be very difficult, and it's going to be, we've got to be pragmatic, and Andy Hawkes mentioned that last night, and I completely agree with him there. What we've got to try and do is fit in health and well-being around our tricky schedules. So stuff like being able to stretch, and know the Healthy Working app from Cardiness includes stretching exercises within its launching on Friday, I understand, John. It's making sure we stand up and move every half an hour to make sure we comply with the public health recommendations. It's making sure we do try and optimise sleep, even if we are getting woken up at certain periods of the night. So it's trying to fit in and prioritise health and well-being during what is an unprecedented time.
Yeah, Harry, thank you. John, I'm going to come over to you at the moment. We've had a really nice comment from David Chard around DSE assessments and some feedback from the HSE. Can you actually comment on that, and also just talk a little bit about sort of the app that we've got coming out on Friday?
David, I absolutely support the comment that you've made there, that one of the biggest areas of panic that I'm getting from my customers right now is what are we doing in terms of DSE assessments, education for our home workers, our new temporary home workers. And in reality, there is little point in following the DSE regulations, because the guidance that is provided is education really based around using a desk and a chair. And if we think about the way that our home workers are really going to be working, if we look at it pragmatically, they are going to be sat on a couch. They are going to be sitting at a dining room table and chair where the chair is too low for them, alternatively sitting at a kitchen counter. So it's very difficult to provide any kind of training that is really going to address the specific needs of each individual. And certainly if you risk assess these individuals, you're just going to uncover a lot of risk that actually organisationally we're not going to do anything about. We're not going to go to the expense of giving people a chair or a desk or anything like that. So the advice that we are giving is to make sure that you're getting key messages across, that if you are sitting on a couch, just make sure you've got a cushion to support your lower back. Make sure that people know to stand up and stretch frequently. If you're sat at a kitchen counter, get up, move, keep the body fluid, keep the body moving. And we have in support of that a free of charge app that is available to all of you. If you go into the Apple or the Android marketplaces and just search for Healthy Working, if I'm honest with you, right now it is out of date. We're scrabbling to bring it up to date to address these particular risks. So right now it does talk about using a desk, using a chair. On Friday, the advice that app provides will be: you're sat on a couch, this is what you need to consider. You're sat at a dining room table, this is what you need to consider. And it also then provides a bank of stretch exercises that the individuals can take. Now, in terms of some of your more vulnerable employees, there's two real groups. So you've got your people with disabilities, perhaps your wheelchair-bound employees. They might be the least of your problems, because the more severe the disability, the more likely they're going to have modified environments at home to help them live and work a little more effectively. You're probably your highest group of at-risk areas are the people who may have been injured in the past, or maybe have had surgery and are experiencing pain, where you provided them with modified equipment, and now we're taking that equipment away from them. So what we advise in those cases is for people with disabilities, with injuries, or people who have special requirements, simply a conversation with them, a documented, file-noted conversation, just to explain what is happening while the equipment is no longer going to be available to them, perhaps, and what they need to do if it becomes problematic. As the next stage onto that, you may need to think in a few weeks' time about shipping some of this equipment to your employees. Even then, that may not be possible if they don't have the real estate within their houses for that equipment. So it really comes down to making sure that we are communicating with them, the key to everything we know, but we are making sure that they understand if things get too severe, they need to reach out for help. But certainly in terms of following the DSE advice, David, I'm absolutely with you.
Could I just come in there? Sorry. So, morning everyone. It's Amric Singh from Homes England, and I absolutely agree with what John has said there about DSE assessments for home, because there is going to be, we've got to have an understanding that people definitely will be working at the dining table, and on a sofa and that sort of thing. And my view is that we should just concentrate, with this ever-changing picture, that it's about the advice that we give to each specific person that suits that individual, so they can, have the most ergonomic setup that they can. But the question I wanted to ask, and I didn't get to ask, was, and it's really for Jocelyn and Harry, and it was, in terms of well-being, have you got any advice of a frequency, how often, or what kind of interaction a manager can have with their member of staff that's working at home to sort of get the best out of it, rather than continuous phone calls and that sort of thing? Because we know that lone working, and many people will be lone working at home, can be detrimental to one's physical and mental well-being. So is there any advice around there of what sort of call should be made, what sort of question should be asked, and that sort of thing?
Amric, thank you. Jocelyn, if you'd like to respond first on that, and Harry, if you could just follow up, if that's okay.
Yeah.
Certainly, that's a great question, because in some instances we know some people will automatically be be able to supervise themselves and be independent and working better than others. Just inherently, we know that that is already a reality. So now in this sort of context, I think it becomes important to think about the ways in which you're communicating with people. And as a manager, I don't know how sort of extensive your team may be, but it's just really about getting balance. And potentially asking staff just to feedback in terms of, you may give an initial suggested way of working, but feedback, evolve it over a period of quick period of time, just to understand. Also, just put in sort of little cues in terms of your communication. So if you've got a regular team catch up, just remind people that if it's appropriate, if they feel they need to reach out to you, just do so when you may be best available, if it works for them. Otherwise, let them have the confidence to approach, to let you know that they may need to speak to you at another point, and obviously work it forward. I guess it's about just finding a new way of working. So if you've got the regular contacts, just understanding where they can come to you, in terms of speaking, how best that may be. Some people prefer a phone call, maybe rather than necessarily doing it on Skype, or perhaps an email. It may be a question also of understanding whether or not within your teams you want to create a sort of a buddy system. Because this is a period of change, as we've been talking about, and it's really having information that certain people will react better to something written. Other people may want to just have that sound check and not necessarily need to, if I could put it in quote, manager involved. It's not sort of a formal conversation. It's more of an informal relationship that they just need a test point. So I think it's worth, as I said, putting in place a potential way of working, keeping the option open to get that feedback, and just evolving it as people move forward. And additionally, having the availability to really manage that. And if there are additional ways in which you can help to just remind people how to have a conversation, because, somebody wanting to talk to their line manager, you never know what it might be. Simple things, somebody might say, will you have time available? We would tend to probably say, well, what's it about? Can you let me know? And in a way, that's quite a judgmental statement, because then the response might be from the other side, well, actually, maybe it's not that important. I'll leave it for another day, or they're really busy. I don't want to disturb them, because everybody's trying to work to the best way possible, assuming good intentions. So it's just really a case of thinking about how you may even respond at that level, just to keep it open, non-judgmental in your language. Think about how they, then may want to raise a question and manage a situation with you. They may want to disclose something that's going on within that home environment that you weren't previously aware of. All of these kind of things to get in. We have, sorry, there's a lot there, sorry.
Jocelyn, just slipping across you, I think the important thing really is to encourage, sort of managers to be talking to their staff. I think the other group of people we need to consider are those that actually are unwell at the moment, because, there is a fear of losing contact and that isolation. So I think it's really important that we do that. Harry, again, I'm very conscious of time. So is there anything else you would like to add to that?
Yeah, keeping it very short. I think there's three things, and it echoes exactly what Jocelyn said, really. It's communicating through multiple ways. So whether that's video calls, phone calls, emails, there are lots of ways that we can communicate remotely still. The second thing is we're learning, and we need to learn. We need to be able to A/B test things, and so the only way that we can effectively be able to see what's effective is collecting data. So simple staff surveys that take 1 or 2 minutes to fill out can be very effective in terms of that. But then also keeping the door open. So there's a very fine balance between not micromanaging employees or our colleagues, but what we want to do is keep the door open. So if someone is struggling, then they can always get in contact with you as well. I think that communication goes two ways, from a colleague to yourself and vice versa.
Harry, thank you. Claudia, we had a conversation before we actually opened the call about our facilities teams, because we've sent a lot of people home, but there are other people we ought to be thinking about at the moment.
Yeah, so I had a conversation with some facilities managers from the facilities manager network I used to belong to, and a lot of facilities, estates and security personnel are still working, and they're finding it quite odd. So we've been talking about people working at home and they're lone working, they're isolated. The facility staff also feel the same way. You know, you think about your sort of your average electrician who's in your building. It will interact with probably about 20 people a day, and that's not happening now. So if you are responsible for a building, or you're a health and safety manager, or even a senior leader, please reach out to your facilities teams and your security teams and just have a conversation with them, make sure they're all right as well, because these are the people you're actually going to need to communicate with once the pandemic is over and we need to move back into those buildings. So please, I encourage you to speak to those facility staff.
Yeah, and Claudia, thank you. And I think the other thing as well is that David, you raised a question or a comment about teams that are working in a response to going to people's homes and other environments where, you know, we've got to actually think more, you know, clearly about making sure we give them good advice, particularly if they're undertaking electrical work in, you know, a housing setting. So, you know, again, when you actually have a look at your vulnerable groups, you know, really what I would encourage you to do is not just focus on those that are remote working, but those groups that actually, you know, remain behind. Now, I've just posted on here is that, you know, does anybody else have any other questions? And what I will do is I'm just going to go around our panel and just ask for some last insights, but we'll give you some time and space at the end of the session to ask any other additional questions you've got that are, you know, sort of relevant to yourself and your circumstances as they stand at the moment. So, Claudia, is there anything additionally that you would add to this session?
I would just like to reiterate what we said yesterday. Please do not get your coronavirus information from social media. Social media is great. It's got, you know, it's a great way to communicate with your teams and with friends and family, and there's very amusing photos on there. But please do not get your coronavirus information from it. Please use websites like the BBC, WHO, the CDC, government websites. Please use a reputable website to get your information from. Do not listen to the rumours that were going on social media.
Claudia, really sound advice. Thank you. Andy? Andy Neil?
Yeah, Peter, yeah, thank you. I just think just good communication patterns really, and have a good open communication is key to all of this, and make sure that workers feel supported and everybody's working as a team, even though they're working remotely.
Yeah, Andy, thank you. Harry, any additional insights or things you think we should be doing at the moment?
I think we just need to really focus on the moral side of things in terms of what can we do to optimise employee well-being during this period. I saw something last night about physical distancing, not social distancing, and I thought that was really interesting in terms of making sure that we do stay socially connected during this unprecedented time.
I think that's a really good point, because I think we should be sharing experiences and how we can work better. And I think actually that leads nicely into Jocelyn, to you. Again, have you got any last thoughts that you can share with everybody?
Well, I totally agree with what Harry was saying, and this is a period of change, but we're not isolated yet. It's knowing how to stay in contact, and social distancing is different. From a sort of an employer perspective, and it's really critical actually at this point, just to know how what provisions you as an organisation have available to your teams, and just to make sure that it's easily accessible. So having a clear central portal and clear sort of support, also importantly for your line managers or people managers, just so that they know how they can best manage conversations and support staff, so they're kept up to speed as well with changes appropriately to help in disseminating and giving confidence going forward.
Jocelyn, that's lovely. I think there's an underlying message here about us being kind to one another and also being kind to ourselves, which I think is really important. So I'm going to start to pull the meeting to a close now and I'm going to ask John to give us some final words. I have, we just had a comment in from David. What we will do is we'll pick that up once John's actually finished closing down, and then what we'll do is we'll just remain online for a few minutes so that if anybody's got any additional questions they want to ask or want to stay behind and just pass a few comments, happy that you do that. So John, would you like to bring the meeting to a close?
Yeah. I mean, my final words on this really is just to be pragmatic. Nobody's going to have all of the answers to all the issues that we have, because to a certain degree we're very much learning as we go along in terms of what regulations may apply, the right way to communicate with people who have simply never been in this home working situation before, and having to not only deal with the change into a home working environment, but also having to change their social environment as well, in terms of spending more time with family, with their spouses and other people too. We have created a suite of free resources that you can use. I mentioned the app already. That, as I said, is out of date. On Friday it will be brought right up to date, and it is available to all of your employees through the app, through the Android and the Apple stores. We've also created, and we'll be launching them later on today, a series of 10 email templates that you can use and edit to communicate with your colleagues. And these relate to what to do in terms of a fire in your home when while you're working from home, how to deal with social isolation. It looks at diet when working from home, making sure that you're A, that you're eating, but B, that you're not eating too much, sleep and fatigue, ergonomics. It covers off a range of safety and well-being issues. And if anybody here would like those emails, drop us a line, because we're more than happy to share them with you. And we're also, whilst we're globally really well known for our e-learning solutions, we do not yet have a solution for this temporary home working environment. We're working on that right now, and we're hoping by close of business Monday to have some files that, if you're already a customer of ours, will be added to your healthy working system. By Monday we hope to have some very pragmatic e-learning that is looking at the reality of working from home and addressing the risks that people really experience, as opposed to any kind of advice that you might get through the DSE regulations or otherwise. But I guess my underlying message here is we've got some great experts that we work with. Our partner network is, to my mind, exceptional. If any of you guys have any questions, we are absolutely here to help. So pick up the phone to us, drop us an email. If we can't help, bet your life we know somebody who can.
John, thank you ever so much. I'm just going to really finish on a comment from David. And again, David, I'm happy for you to leap in at this point. But I think there's a real important thought here, is that, we are going through this. There is going to be a stage where we return to our offices. And when we get to that point, what we would look to do is actually put together another session like this to actually, sort of help people transition back to the workplace. But I thought, David, that was a really good comment from you.
Okay, thanks. Yes, it's just about this apparent inconsistency between the World Health Organization's advice that can transmit up to 14 days after recovering from the immediate symptoms, and we thought, well, we didn't want to reintroduce them to the workplace. Obviously, we're keen to, in terms of their well-being, and to restore business as usual as quickly as possible. But there were all kinds of issues about other prejudices from other staff potentially that have tuned in to this inconsistency, this apparent inconsistency, and so you're kind of between a rock and a hard place, really, because you want to bring that person back and introduce them to the workplace as quickly as possible, but at the same time, there's a little bit of conflicting advice out there. I didn't expect an answer to it, and I'm sorry if I've just presented an observation rather than a question, but it was just to highlight about we're looking at putting in place some enhanced return to work protocol.
No, Sorry, Claudia.
And address. I can kind of address that, David. So there was a study from the National Institute of Allergy and Infectious Diseases in the United States. This is one of the government research centres who have been working on COVID-19. And I think you alluded to it. It's very difficult to tell because it's a person by person issue. So they've actually shown that a lady in China was infectious for 24 days and never showed a single symptom. There has been studies that showing that the incubation period is 19 days. So what you are saying is correct. We will be having a session about bringing people back to work. But yeah, the information out there is conflicting. But I'm actually doing some research at the moment looking at the actual research papers where they've actually taken the patients from China and the States and in the UK and actually looking at that incubation period and how infectious they are. And I'll put a report together to summarise that.
That's very helpful, Claudia. Thank you.
Okay, big thank you to everybody. We'll draw the meeting to a close. We will stay here for a few moments, so if there are any questions or anything else, please just raise them to us. I wish you all, a good day and hope that you keep all safe and well. Thank you.
Thank you, everybody.
Thank you.
Thank you all.
I just have one question. Sorry.
Yeah, no, go on.
The Healthy Working app, you said that it'd be updated. Was there a time given or a day given when that'll be completed?
It'll be Friday.
Friday?
Yeah.
Great. Okay, that's it. Thank you.
Yeah, thank you.
Just Stephen, are you able to confirm it is Friday? Have you heard back from the developers? Stephen, are you on mute?
Yes, sorry, I'm here. Yes, we hope Friday. It might be Monday.
Okay.
David, if not, one of the email templates I was talking to you about earlier includes still images of those stretch exercises and text description as well. I'll send that on to you. That also might help in the interim. Great. Great. Any further questions just before we wrap up? Wonderful, guys. Thank you all so much. Thanks to the panel. Really appreciate it. And
thank you to everybody.
I'll speak to you all later.
Thanks, everybody. Cheers.
All right.
Have a good day.
Okay.
Thanks, everyone. Catch up later on.
All right. Thanks. Bye. Bye.
Bye.